question for now is going to be from here.
Gary Filerman. Gary Filerman from Georgetown. What are your perspectives on technology assessment, the elephant in the corner of the room? We've heard the word sustainable now for unsustainable for 25 years, and we have periodically flirted with technology assessment as a cost containment and rationalization tool readily available to us, or more readily available to us than some others. What are your views on when and where that's going to happen?
A couple of folks want to take a crack at that. Dr. Cabo?
Well, I think we need, it sort of gets to my first point that we haven't set either a floor or a ceiling. So, and part of setting the ceiling is that you really have to assess technology, devices, and pharmaceuticals to say which ones of these existing and new technologies actually add value. And I think without doing that, we have non-evidence-based introduction of various methodologies into our treatment armamentarium, which may not be useful and certainly will be costly. And I think it has to happen at the national level. I know our state is trying to do that, and California has done a technology assessment, but I think it's very hard to do that state by state.
Plus, this time we really mean it. It's unsustainable this time. I think we're going to have to leave the questions there just because the hour is drawing close. I want to invite Len Nichols up, who's going to offer some closing remarks, and ask the panelists to stay seated while we thank them for their wonderful conversation and contributions to this debate. And with no further ado, let me turn it over to Len Nichols, one of the best health economists in the country, in my view, for some closing remarks.
We shall belatedly count those thanks for Matt as well, but I do think he did such an outstanding job. We'll give him his own round of applause, if you would. You can see why he's a celebrity moderator. I want to just offer a little bit of thanks and then one benedictory remark, and the thanks start with Charlie Kobe, who we began this conversation, I don't know, a few months ago, and with Lenny's help, I think this turned out to be a very good idea, so thank you for making it happen. And when we got Better Healthcare Together involved, we knew it was actually going to be a big success, so thank you, Jody, for making it happen. I want to single out two human beings who actually made this happen, whose names you have not heard today, and they are on my amazing staff, Elizabeth Carpenter, who worked with Amy Morse from CED. I don't know where you are, but you should be drinking champagne or at least standing up by now, because you really did do yeoman's work to make this occur. My benedictory remark is basically this. If you take the expertise that is in this room, and you take the knowledge and experience and all the good ideas we've heard, and you marry it to the commitment that is also in this room, which is manifested not only by your participation and willingness to join these discussions, but the fact that you showed up on the coldest day I personally can remember this side of Graduate School of Illinois. I want to say, go forth and make it so. We can do that. Thank you very much for coming.